Hey everyone, so I just wanted to make a really quick video. It's like midnight, so it's technically Friday right now. So I'm on day 3 post-op, technically. So I went home on Wednesday, which was really cool, because they didn't like make me stay the whole day Wednesday, which they were maybe gonna do. So they did not, and I'm excited about that. So I'm pretty much rocking my look right now. Bandages and binder, kind of combined. I'm sleeping on this recliner in the living room. I have a little table with all my medicine and some water and cough drops because I'm a mess. Speak of the devil. Um, and yeah, so that's pretty much what I've been doing with my time. It hurts like a fucking bitch, as you would expect, because they did cut myself open, and cut my boobs off, which was nice. But yeah, so I got to like see my chest as I mentioned in another video, which was cool, and I've been seeing it. Like I saw it again today, well, Thursday technically, because they changed the bandages and like all's looking good. Like it doesn't look infected. Like stitches are fine. Swelling is like the swelling's gonna keep increasing. Like and then like today it's gonna swell a little bit more, and then it's gonna go down from there. Is basically what was explained to me, which is generally what's happening. So it's like taking the right timeline, which is nice. That means I'm healing. Um, God, what else? Functionality is a thing. I've been out. I left. I went to go to pick my brother up today. My grandmother in the car. And I got Starbucks, which was honestly like a little bit difficult. I had to like pay and like move my arms a lot. It was a lot harder than it really needed to be. As for like arm function, it's weird because it's like I can like raise my arm. Okay, that's about as high as I can raise my arm. But if I'm trying to like push up or like pull something down or like lift anything, like I can't put weight on my arm when it's that high. And this one I can only bring about here. Because I don't know, there's something like over here that like the stitches are like pulling more and it's like more sore or something. I don't know. That was also the side that was bleeding a little bit more too. So I don't really know what that was about. But like it's fine now. I just need to be really careful. I also like I think I overdid it a little bit today by trying to cook pasta. Because my grandfather doesn't know the difference between a fork and a stove, so having him help me was a little bit. It was a lot. My grandmother wasn't home, but I was like starving and I didn't want to eat chips for dinner. So that's the thing. What else was I gonna say? Oh, the medication situation is weird. When I was like in the hospital, they didn't want to give me clonidine because they were like, "Oh, we don't know why. It's just not in here." And they gave it to me in the morning when I basically begged for it because I was like, "You didn't give it to me last night because you said it was in for the morning." I was like, "And now it's morning, and you're saying it's in for the night." I was like, "I'm not even gonna be here tonight." I was like, "Why can't I have it?" And like if they could give me like a medical explanation as to why I should stop that medication, I would have. But like they specifically told me to take it the morning of surgery. So I was like, it's obviously not interfering with anything. Like if you specifically said to take it. And they were like, yeah, we don't really know. So you cannot take that when you get home. So that's what I did. The only thing they said not to take was Benadryl, which I'm really starting to like question because I really want to take it because my skin is a mess because I haven't been like following my skincare routine. Like you can like see it. It's like it's all over. I'm not a fan. Because it's like it's difficult to move. Like every single part of my body is sore. Everything is sore. Literally every fucking part of my body is sore. It's very irritating. Um, but I mean, it is what it is. Like surgery is like taxing on your body. So I'm on all of my medications now. I'm also on pain medicine. They gave me, it's 5 milligrams of Percocet combined with 325 milligrams of acetaminophen. And I can take one or two of those every 4 hours, as needed for pain. So I've been taking, two of them in the morning and then two at night, like right before I go to sleep, and then one every 4 hours, like during the day, unless it's like really really painful. Like if I was just out like in the car, like car rides are hard because there's bumps and it hurts, things like that. So it's like I pretty much go on like how much pain am I actually in, and if it's not that bad, I just stay with one because like if I keep on top of it, it's not bad. I'm not a fan of taking narcotics at all. So I'm trying to keep it like down like the level. Like I obviously like need to take them because like it hurts like a bitch. but I don't want to overdo it with the medication. Like, if I don't need to take, like, the higher dose, I won't. It also, like, it makes me, like, kind of, like, checked out and foggy and, like, really sleepy. And, like, I'm having, like, issues speaking right now because I took all my meds and I'm tired. So this video is not going to be very long. I don't know why I waited to make it until now. But, like, it makes me a little checked out and foggy, and I don't really like feeling like that. So I've been napping a lot during the day, but I've also been, like, getting up and doing things and stretching. And then you need to keep, like, walking to, like, make my lungs work again. Because when you have surgery, they basically stop your lungs from functioning and they breathe for you. So getting your lungs to re-function again is a little bit difficult, especially when you have breathing issues like I do. So I've been coughing a lot, coughing up, like, some blood, which is concerning. But, like, the surgeon's office is today that happens a lot with chest surgery, and to just, keep getting up and being active. And if breathing becomes a serious issue, use my nebulizer, go to the emergency room. But they said that what I'm experiencing right now is pretty normal for a patient with respiratory issues already. So I'm not too worried about that right now. What else? What else? Just, like, weird, like, post-op things that, like, are happening right now. Okay, honestly, some of this is really gross and, like, TMI, and you probably don't care, but I want to document it anyway. Okay, using the bathroom is fucking weird, okay? So apparently I googled this shit. Like, when you're under anesthesia, it, like, messes with, like, your bladder function. So it's like you feel like you need to pee, but, like, it doesn't work. But it's like you have to pee, but, like, you can't make it happen. So you just kind of gotta, like, wait. And it's, like, weird, because it's, like, if you, like, push anything, like, it fucking hurts your whole body. You use your entire body, and it's not working. So it takes me, like, 15 minutes to pee, which is really irritating, because my grandmother's like, are you okay in there? And I'm like, yeah, just waiting, have all day. It's ridiculous. And, like, honestly, like, taking a shit is fucking the same. It's ridiculous. Like, it took forever because surgery does that. I'm like, I finally fucking did it today. And it was, like, a process because you can't, like, make anything happen because it hurts. Like, I'm not gonna pop a stitch by taking a shit, okay? I'm not gonna do it. I'm not gonna be that asshole that, like, walks in the emergency room fucking bleeding, like, oh, I was, like, taking a shit and I popped 7 stitches. Please help. I'm not gonna do it. I like, popped my fucking armholes in December. Been there, done that. Not happening. I'm not doing it. I'm not. I'm sorry, I'm not. What else? What else was I saying? Yeah, so, like, that's the thing, and, like, everything, it itches. Everything itches. And, like, and it's worse because my skin is already, like, really itchy and weird, which is why I want to take Benadryl so bad. But, like, they said not to. I think that tomorrow I'm gonna take some. Anyway, and just see what happens. Like, I'll do it, like, during the day, just to make sure that it's fine. But, like, whatever. I'll be with people during the day, so it's fine. Like, my grandparents are home. Well, my grandmother is all day, to help me with things. What else? I had, like, a thing to say. I don't know. Oh, I get to take, the ace bandage off, on Friday. Well, it's technically Friday because it's after midnight now. So, like, today I get to take, like, the ace bandage part off. And then underneath it is, like, this little fun zipper thing, and it has, like, clips. I'm really, like, I'm debating on whether or not I want to, like, show this, like, on my YouTube channel, because, like, I have pictures. I have pictures from, like, day 1 post-op, and then from yesterday, and I'll put, like, I'm gonna keep taking pictures to kind of just, like, see. But, like, I don't really know. I'm very self-conscious about, like, what my chest is gonna look like, and, like, what people are gonna think about it, which is weird, because it's, like, I like it, like, but also it's not, like, completely flat, because, like, I'm not exactly the thinnest fucking person in the world. So, like, if it was completely flat, it would look really bad, like, with my body. But it's, like, I don't know. I was, like, telling someone about it, and they were like, oh, well, it, like, probably looks, like, gross and things like that. And I know that, like, it's just because it's swollen and weird. But it's, like, what if somebody hates it or something? I don't know. I'm overly self-conscious about it. Like, I feel like I would show my, like, actual tits to someone and be like, whew, here they are. What's good? But, like, this, I'm, like, very, I don't know. I feel like it's also because I'm not used to it yet. And I need to get you, like, I've only showed one person like, I mean, my dad saw it, like, in the hospital. My grandmother saw it helping me with my bandages today. But, like, I showed my partner, I sent them pictures, and, like, and it wasn't, like, a bad reaction, like, at all. It was just, like, they reacted, and it was, like, normal, and, like, everything was fine. But I was, like, really, really scared to do that. And, I mean, and my partner is, like, an amazing person, and, like, they wouldn't say anything, like, mean to me at all, like, especially about this. Um, but like I don't know, it's just as weird. I think that it's an idea that I'm gonna have to get used to. Also, like my emotional state is like really weird and like kind of gross. Like after surgery, like my moods are just really fucked up, and I don't really know. Um, I'm sure that there was something else that I wanted to say, but I'm fuck. I'm like I took my medicine and it's like really starting to like work right now, so I need to go to sleep. It's past midnight and I'm exhausted and I'm medicated. So I'm gonna just upload this and I'll probably make a video maybe tomorrow or 2 days from now. Like once I get like the ace bandages off and start functioning a little bit better. I'll talk more about that. And I'll probably make a video during the day when I'm more coherent. So yeah, thanks. See you guys soon.